Today we're speaking with Congresswoman Donna Christensen, a Democrat who represents the U.S. Virgin Islands. Thank you so much for joining us.
Thank you for having me.
Can you tell us about the demographics in the Virgin Islands?
Well, we're 3 islands, 3 and a tiny one called Water Island. About 120,000 people approximately, maybe a little less, divided on the islands. About 76% are of African descent, and about 20% probably Hispanic, although it's mixed. Some of the people that I would say would be of African descent would also be Hispanic, and the rest are either white, very few Asian.
What challenges do Virgin Islanders face when it comes to cancer health disparities?
Well, we face a number of challenges. Some of the programs, for example, that states are eligible for that might be helpful in addressing either screening, early diagnosis, we're not eligible for. There's some that we're not getting, but there are many that we're not eligible for, which is not helpful. We have a Medicaid cap, which limits the number of people that we can cover with Medicaid, and so that diminishes their access to health care, and it keeps people from going to seek health care. There are the normal stigmas that we face with many diseases, but still there's still a stigma around cancer, and people tend to wait until it's very late still in their disease to seek treatment. Sometimes the treatments are not always available on the island. We now have a cancer center in St. Thomas, which provides both chemo and radiotherapy, but still people from St. Croix have to travel to St. Thomas. Before that, we'd have to travel to Puerto Rico or Miami. So there are many challenges that Virgin Islanders have to overcome in terms of reaching the kinds of services that they need, even just for screening. But we do have mammograms. We have physicians that are performing colonoscopy, so the routine things can get done.
You've championed legislation to reduce racial and ethnic disparities in breast cancer and in lung cancer. Can you talk about those bills?
Sure. One bill is 2112. That's the Lung Cancer Mortality Reduction Act. And what that does is it increases early screening. It provides for earlier screening for lung cancer. It's very surprising to know that almost 20% of people with lung cancer don't even smoke, or more. I think I think it may be even 60% of former smokers also get lung cancer. So we want to make sure that not only there's smoking cessation, which is really important, but we have to be able to reach those people who have stopped smoking and who have never smoked as well. So it provides for earlier screening and more opportunities for screening, more funding for screening for that disease. The other one is the Eliminating Disparities in Breast Cancer Treatment Act of 2009. It's 2279. I introduced that with my colleague Betty Castor from Florida. And that is it's based on a pay for performance. It sets certain measures that physicians, providers must meet in dealing with people who come in for breast cancer screening or who are diagnosed with breast cancer. And there are incentives for meeting those measures, and there are penalties for not meeting those measures. So it tries to ensure that when a woman gets to a provider, that the same kind of care is provided. There are major disparities in breast cancer for African American women. It turns out that we get mammograms just as often as our white counterparts, but we're still diagnosed later, and we still die more frequently. And in lung cancer, there are disparities as well. African Americans who smoke tend to get lung cancer more frequently than their white counterparts as well. And all of that needs some more research.
You've long championed the issue of overcoming healthcare disparities. What are some of your goals?
Well, right now our biggest goal is really following the implementation and monitoring the implementation, guiding the implementation of the Patient Protection and Affordable Care Act provisions. We were very successful working with the entire Tri-Caucus, that's the Black, Hispanic, and Asian Pacific Island Caucus, in getting provisions in there that we felt would help to address and eliminate health disparities. Community health workers is another very important provision that we want to see implemented, and that was an amendment of mine that I did with Betty Sutton. And they have proven very effective as patient navigators for cancer in particular, the promotoras in the Hispanic community, and we really want to expand on that program. The health professions piece, trying to make sure that there are more providers of color from different racial and ethnic backgrounds in all fields, from the promotoras of the community health workers to the physicians and nurses, and we have provisions that try to support the training of more underrepresented minorities in the health professions. And there's several other provisions, but so we're going to be monitoring them very closely to make sure that none of that gets lost in the implementation phase. And then there was one provision that we really didn't get fully into. There's several really that we didn't fully get into the healthcare reform legislation. One would be our health empowerment zone legislation. It's a part of a bigger piece of legislation that's called the Health Equity and Accountability Act, but it's also standalone. And we really think it's important not only to address disease and the treatment of disease, but to address the whole environment in which people live. And this would enable communities with high health disparities to get some seed funding from Health and Human Services, to really assess their health needs, identify what their particular health challenges are, and seek designation as a health empowerment zone. And if they get that designation, they would have priority eligibility for programs throughout government, because it's not only Health and Human Services that can help. Sometimes it's a housing issue that needs to be addressed, maybe an environmental issue that needs to be addressed, so EPA could come in. And we think it's very, very important to look at the whole picture. In that regard also, we're also trying to get an executive order from the White House that sets health policy in every policy, so that every agency of government would not only be involved in helping to create the kind of health supporting environment that is required to eliminate disparities, but that health equity would be a part of that. And we've been working on that for 2 years. So we see it beginning to happen in different areas. For example, in the Let's Move, there are many agencies that come together behind the anti-obesity program that the First Lady is spearheading. So we're hoping that will gel as well. The other thing that we didn't get into the health care reform bill, and which we think is very important, is dealing with scoring prevention. We were able to include many prevention provisions in the bill, but we were limited in what we could do because of the scoring of the bill and the cost of the bill. While many of us feel that those prevention provisions are going to lower the cost, maybe not in the first 5 years, maybe not even in the first 10 years, but after that, you will see the cost of health care going down because of some of those prevention provisions, but we were never able to score it. So we couldn't get, for example, dental provisions for adults in the basic health care package. We got it for children. But so we want to work to have the Congressional Budget Office look at prevention and be able to score it. And there are probably some other things, but those are some of the key things that we didn't get done that we're still working on and we look forward to working on. Of course, lifting the cap for Medicaid for the territories would be very, very important. We were able to get some funding for the territories and a significant amount of funding, but it still does not put us on a par with the states, and we have not been able to fully access the exchange that will come online. And I think that's very important to ensuring that individuals in the territories have access to all of the care that they will need. And it's very important to early screening for cancer and for making sure that they get the proper treatment.
And what do you think is needed to overcome cancer health disparities, and what can cancer researchers do toward this common goal?
Well, one of the things that needs to happen is we need to, and it's not just the cancer researchers, those of us in Congress and community activists need to get involved, community leaders. We need to get more minorities into clinical trials. It's been a long-term problem and we really have not resolved it. So we really need to do that. I think there needs to be more behavioral research. We've done great work on the genetics of, for example, breast cancer and so forth. But we have to figure out how we're going to change behavior and how the community environment impacts cancer and cancer-seeking service, patient-seeking services, if we're really going to be able to eliminate disparities. So I think we have to broaden our research. And of course we have to get it from, as I said, from the laboratory to the bedside much quicker than we do right now. Hopefully some of the recommendations that come out will be more thoughtful with regard, for example, to mammograms in younger women. That could have a very adverse impact on women of color, African Americans, and even Jewish women who tend to get certain kinds of very aggressive cancers early. So, but clinical trials is a very important part of it, and then broadening the research to make sure that we include more behavioral and community-based research. I think that we have a great opportunity now with healthcare reform, where the access to healthcare is going to be greatly expanded. It's not the whole answer, but when one has access to preventive care and access to early care and to health maintenance services, that is going to make a big difference. So we have a great opportunity. We have to make sure that those benefits are understood by our communities and that our community accesses those. So we have a job to do there as well. But that having been said, insurance is really just part of the issue. And that's why we fought so hard to make sure that there were disparity eliminating provisions in the bill. And those don't get a lot of publicity. But I want to reassure our community out there that there are provisions that will bring some of the other needed services to them. Because while insurance is important, it accounts for maybe 20% of the disparities. So we need our community health centers. We need our providers to be diverse, of color, coming from the communities that they live and grew up in and that they understand, to develop that kind of trust. We need our community health workers. We need some of the community grants that we have. They don't quite meet the Health Empowerment Zone standard, but they're a good start to provide community organizations with some planning money. So there's a lot in that bill that can help us, and we look forward as a Congressional Black Caucus and as a Tri-Caucus to reaching out to our communities and helping to ensure that they know what's there and that they can access the many provisions that will help to eliminate health disparities.
Thank you so much.
You're very welcome. Thank you.